Welcome, committee. We'll go ahead and bring the Tuesday, January 24th Welfare Reform Committee to order. Just jump right into it here. So the first item on the agenda is to approve the committee minutes from January 17th and January 19th. Comments on the minutes? No comments. Asked for a motion to approve the minutes. Sorry. Representative Meyer.
Motion to approve.
Motion by Representative Meyer and a second by Representative Johnson. Any discussion? No discussion. All in favor say aye. Aye. All opposed, same sign. Motion passes. Next up is requests for bill introductions. Are there any requests for bill introductions from the committee? Any from the audience? No bill introductions. All right. So the next item on the agenda, this is just a review of the member requests from some of the presentations. And we did get a packet from DCF. Looks like this is some of the follow-up items from the January 17th TANF discussions. And I think Dr. will start by going through this when she comes on up. But also you see a little single piece of paper. This is just a little Google spreadsheet I'm keeping on the meetings. Kind of helps me stay up with kind of some of the discussion. The format may change slightly, but I'll try to keep this in everybody's packet each meeting so we can kind of make sure all the committee members are getting their answers they requested. And if I ever miss anything, please let me know. I can add it to that. I think it's pretty self-explanatory, but if you have any questions or suggestions on how to make it better, just let me know. But with that, we'll go ahead and start with the presentation for today. We'll go over child care assistance, but before that, I think, Doctor, if you've got take a few minutes to go through some of your follow-up from the TANF meeting, that'd be great.
All right. Good afternoon, everyone. So to the committee chair, the vice chair, and the ranking minority member, thank you again for the opportunity to come and share information with you. So you did have several follow-up questions from the TANF presentation last week, and so what we've provided is the responses to those questions. One was regarding single state audits and what that process looks like, and so we've provided the definition of those audits and the federal statute that requires those audits and under what circumstances. Another question was around the states that have lifetime TANF limits that are fewer than 24 months, and so we provided that information for you, and then also at 24 months provided that information, and then also a link to the data book that has all of those details in it. Limitation on kinship placement, so we've provided the response to that. There's also, on the next couple of pages, detailed information around why TANF cases are closed or denied. There was also a question, this is the table that you have, there's also a question around the programs that we have that are specifically funded under TANF Purpose 3, which has to do with out of wedlock pregnancies. And so we added a column to this document that lists those, that is, again, TANF Purpose 3. So those are the programs we are currently funding that would address that. Yep.
Sorry, Doctor, whereabouts are you? Which page?
Oh, sorry, I'm on this page right here.
Thank you.
I zoomed on past you. And then there's a pie chart. I believe that information was also requested, that we provide a pie chart that would give the percentages of how we spend TANF dollars. And the last couple of pages, the last 3 pages, I guess, will detail the number of TANF clients we have per county.
Representative Roth, do you have a question?
Yeah, it shows on that next to last page, Cali County with 191 TANF cash assistance. It appears to be third or ranked third as the most expensive or the most using TANF funds. Would you have any idea why Cali County would be at that level?
No, I was just gonna, I have help today. So I'm gonna ask our budget analyst, those numbers, do they include assistance? I'm sorry, do they include supportive payments or just assistance?
That is the average number of clients, persons per month receiving.
Okay.
So 191. Okay. And other than Sedgwick and Wyandotte
If,
counties.
sir, if you want to come on up to the mic, that'd be great. Thank you.
The reason I'm asking, Cali's my county, and Bill Riley's got the bottom half of it, you know, but I'm just kind of surprised to see that there's just so many receiving assistance there, because
Well,
I'm just surprised.
you know, I couldn't tell you exactly why that's the case. I do know as I'm looking, you know, Johnson was higher and
Johnson and Wyandotte.
Sedgwick, Shawnee, they're all a little bit higher than that. But as to what makes up that population and why they're there, that's something that I couldn't tell you right off the top of my head. We could have to do some more looking.
Okay, thank you. Thank you, Chairman.
And something we may end up going over later, I may request this for one of the meetings, more of kind of a breakdown of those individual groups that do the competitive and non-competitive grants, specifically looking at each one and kind of what they do. That may come up later, not quite sure on that one, but I know that question was asked. I think Representative Carr had the non-competitive, I had the competitive. We're asking just more for a description of what each one of those organizations do.
Is that just non-competitive versus competitive, or specifically for the purpose 3?
Kind of both of them.
Okay,
So when you mentioned purpose 3, purpose 4,
sorry.
what's?
Those are the TANF purposes, and the question, as I understood it from last week, was around the programs that we are funding that specifically address out of wedlock pregnancies, and that's under TANF purpose 3. Yeah.
Just take another minute or two, see if there's any questions that come up from this. Representative Howell?
Thank you, Chair, by the way. I have a question that is not specifically in regard to this handout today, but just something that, as I've been thinking about our conversation, last week, I started wondering about, and I'm going off my memory, so keep that in mind. But as I recall, with the breakdown of who is receiving TANF, one of the largest classification was disabled and those that were over the age of 60 with low income. I'm paraphrasing. Does that sound right? Am I misremembering something?
I don't have those numbers with me. I would say it would be single mothers.
And I didn't think to bring it with me today. All right, I'll look at my notes and I'll send it.
Okay.
But-
Yeah, if there's a specific question. So, and to clarify, if the adult in the household is disabled, say, receiving Social Security disability, that adult would not be eligible to receive TANF assistance. The children would be able to receive the benefit, but not that adult. Yeah.
So committee, any questions on some of the follow-up? If we don't have any, we can get into the presentation for the day. There's child care assistance. And quite a few slides, but still, once again, just take a quick pause after each one and
Okay.
take questions as we go. Thanks.
Okay, so the first few slides you have seen at least a couple of times before, just a depiction of the organizational structure, indicating how the DCF programs are intended to work together. And that's the slide. Yep, that slide. Then the following slide, economic and employment services specifically for that. And I will mention with those programs, the intent also is that those programs work together. I know you've had a presentation around TANF, you've heard about SNAP, today is child care, I believe you have employment services coming on Thursday. And the intent, if we are truly going to assist our clients in becoming economically mobile, is for those programs to work together so that we are meeting the needs of the entire family. The next slide. Specifically, the Child Care and Development Block Grant. This is the law that authorizes the CCDF, the Child Care and Development Fund program. That is the program that funds our child care assistance program at DCF. The original act is from 1990. That's when the funding was first authorized through the Personal Responsibility and Work Reconciliation Act, the same act that created TANF. And it required child care funds be transferred to a state or a tribal lead agency. And then, as I said, it created CCDF. That act was reauthorized in 2014, and so those are the rules that we are operating under today. Next slide, please. Statutory purposes. So original purposes were established in 1990, the beginning of CCDF, and then in 2014, some of those statutes were, those purposes were enhanced. So what you see on this slide, the wording that's bold, those are the things that changed in 2014 when CCDF was reauthorized. And what it did, research demonstrates that access to stable, high-quality child care is imperative if children are going to succeed and if families are going to thrive as a whole. So the changes in those purposes was intended to make sure that states, tribes, territories are using CCDF funds to do the best that we can, make sure that we are using best practices in meeting the needs of our families and our child care providers. And on the following slide are just the final 3 statutory purposes that were updated in 2014. All right. The next slide is just the organizational structure from the federal level down. Most of our programs, other than SNAP, start with Health and Human Services, and child care is the same. So this slide just shows how those funds and the authority, the responsibility flows down from Health and Human Services down to, in the state of Kansas, DCF, which is designated as the lead agency for CCDF. On the next slide, federal guidelines outline responsibilities for the lead agency. So listed on this slide are those things that DCF is required to do as part of, it's a requirement for receiving those federal funds. And in 2016, HHS, Health and Human Services, published the CCDF final rule, and so it put these responsibilities into a more structured form so that it's a little bit more clear for states to understand exactly what the requirements of these funds would be. Okay, the next slide, I will say this is my favorite slide for CCDF. A lot of colors. As part of receiving CCDF dollars, we are also required to have this level of collaboration throughout the state. So CCDF is not just child care assistance. We are required to have relationships with all of these moving parts because, again, these parts all work together to meet the needs of our families, of our children, of our providers. So these are just a few. One of the, there are a lot of acronyms on here, I get that. ECAC is the Early Childhood Advisory Council. And in the state of Kansas, the Kansas Children's Cabinet and Trust Fund serves in that capacity. Our Quality Rating and Improvement System, the QRIS, is something that we house in DCF, and that is making sure that our providers have the education, the training, the support that they need to be able to offer high-quality child care services to our citizens. CCDF allocation definitions. So there are, we could say 3 or 4 different pots of money that come with CCDF, and I'm going to address all of these and actually maintenance of effort funds also because I have backup today. So on the next slide, discretionary funds, and you can see the definition of those, and these are the federal definitions of these funds. So that's 100% federal funds that the state receives. And again, our funding is contingent upon us meeting the definition of the law in terms of what we are required to do with our CCDF dollars. The next slide is mandatory funds. Again, 100% federal funds. And the definition of how that is calculated at the federal level. On the next slide, you have the definition for matching funds and how those funds are calculated. The following slide continues that definition for matching funds. And then the definition of maintenance of effort funds and how that is calculated.
Do you know what the amount for the maintenance of effort?
That is actually on an upcoming slide. Yes, I will give you that specific amount. The federal law also outlines allowable uses of CCDF, and these are the 4 basic allowable usages of that fund. And on the next slide, you see for eligible families, and primarily that's 70% of our mandatory and federal state share of matching funds must be spent on these families, the families who meet this definition. And so that 70% is for direct services. That's pretty much our child care assistance. That is money that is going directly to families so that they can pay for their child care needs. On the next slide, a definition of quality activities. There are very specific activities that will qualify for or that are considered quality activities. And at least 9% of our funds must be spent on quality activities, and then an additional 3% are to be spent on infant and toddler activities. And of course, we have the option of going above those percentages to meet the needs. The next slide, child care services, and the definition of what that is, and again, that 70% that we must spend on those activities. The next slide, administration. One major difference, I would say, between CCDF and TANF is that the admin cap for CCDF is 5%, whereas it is 15% for TANF.
Representative Carr.
Thank you, Mr. Chair. I'm sorry, did I overlook at some point the definition of quality services? Did I see that in there?
It's not a full definition, so it gives you how those funds are to be distributed. I can get you a list of all of the activities that would be considered allowable in that category.
Okay, that would be great.
Okay. Did you want the same for the other categories or just quality?
Yeah, give me the same for the
Okay.
other categories as well. Thank you, Mr. Chair.
Sorry, Representative, can you repeat the question? I didn't catch.
The full definition for what is considered quality services?
Okay. All right. The next the next slide at least, will look familiar to you. I don't know if we've mentioned before, but we do have a common application. So there's one application for SNAP, for TANF, for childcare. So same process for submitting that application. These are the different ways that someone can submit an application or submit required documentation that would be needed to determine eligibility.
Representative Meyer.
Forgive me, but what is Amazon Connect?
Amazon Connect is, so as you likely know, many of our workers are working from home these days. So if I'm taking a phone call at home because I need to process your SNAP application, I'm not using my personal cell phone for that or my landline for that. Amazon Connect allows me to do that through an agency-funded system so that the client doesn't know what my personal cell phone number is.
Okay, that's great to know. Thank you.
Okay. The next slide, eligible families. So these are some of the things that we look at for initial eligibility to determine if a family would be eligible to receive child care assistance. And then on the next slide, some general eligibility criteria that we look at.
Sorry, Doctor.
That's
Quick,
okay.
Interruption. Representative Lewis.
On the child care assistance page, the low-income working families, do you know what the income level is?
For child care assistance, we look at 250% of the federal poverty level. But then even if the household exceeds that, the next step up would be 85% of the state median income. And the state median income is the federal guideline. And then states and territories have the option of a different threshold, and we use both currently.
So how do those interface, the two? 5% and the 200?
It is all built into our eligibility system. We do actually have a spreadsheet, though, that someone can look at to help a family determine if they might qualify. So the system will automatically look at the countable income. It will automatically look at where that income falls in terms of the federal poverty level. And those poverty levels are built into our online eligibility system. And so then if the household exceeds that, the next step up, the system will look at the SMI, state median income.
If it exceeds the first, why do you look at the second? I don't understand.
Because the second is the federal guideline. So the federal,
It has to meet both.
it does not. And we are looking at removing the 250% FPL and simply using the 85% of SMI, which is what the Office of Child Care would like for us to do.
Representative Humphries.
Thank you, Mr. Chair. I just wanted to ask about and I'm sorry, I'm kind of catching up. I had to go present at a different committee, but the general eligibility, which is what we're on here, I see on that slide cooperation with child support services. And so can you, is that, this general eligibility, these are the federal guidelines? Okay, so what that is extra things that the state has added, or
So on,
explain that?
yes, on that particular slide, the first bullet, the age range, that is federal, and the second one is also. The third bullet, child support, that, so I referenced the KSA, that is that's in Kansas statute, that is not the federal guideline. We actually, and we're going to talk about this a little bit later, when we submitted our most recent child care state plan, that is an area, that was a finding in our state plan, and we have received notification from the Office of Child Care that that is something that we need to remove from our requirements or risk being penalized financially.
Mr. Chair, could I, and so how long has this been going on? I mean, how long, when KSA 39-709 B10?
I do not.
So what, I guess my question is, how does the, how does the state gauge the parameters? Because I know we can add things, so do you have, how can we learn what the federal government lets us add and what they don't? I mean, it kind of gets back to, I think early on, I was reading in your slides, it said that there is flexibility in the state. I think it was maybe slide 5, to allow each state maximum flexibility in developing child care programs and policies. So tell me how those kind of go together and how we can figure that out.
Sure. So first, CCDF flexibility and TANF flexibility are not the same thing, even though they're both block grants. CCDF it's more, I would say it's more robust, and we get more technical assistance from the Office of Child Care. I have monthly meetings with Office of Child Care. When we are when we are considering making a change in our policies, I run that through our Region 7 staff with Office of Child Care to make sure that we are meeting federal guidelines, and they provide technical assistance to us. They have webinars. They will meet with us one-on-one to provide that level of direction that we would need.
Okay, thank you. I appreciate that. And Mr. Chairman, I just had one more question. What is cooperation with child support services? You said you were going to look into that. Can you explain that a little bit more?
So once someone applies for benefits, and once we go into the eligibility system, we have everything that we need, and we click the button to authorize that first month of benefits. There's an automatic referral that goes to child support services. And at that point, DCF is no longer involved. That's a child support services issue. So they are doing things, and the system does this automatically if there is a parent who is not in the household. So if I apply for benefits for myself and my 3 children, and the father of my children is not on my case, that's an automatic referral. So during our process, I would be asked at the interview, who is the father? And I can provide that information. I can choose not to provide that information. If I choose not to, we would list unknown in the system, and it's still a referral to Child Support Services. At that point, Child Support Services is going to follow up. They will reach out to me and say, hey, seriously, who's the father of your children? If I don't know, they will work with me to gather some information. Basically, what they're wanting, when they say cooperation, it really is what they mean. Respond to the documents that they send. If they send me documents, fill them out and send them back. It's that simple, that basic.
You're saying that the federal government is saying we can't really require that cooperation?
What the federal government is saying is that there must be a full 12 months of eligibility for childcare. So once as the situation I described, the referral to Child Support Services is made after we authorize benefits. What the Office of Child Care is saying is that that is not allowable under federal statute. They're saying once benefits have been authorized, that household must be able to receive child care benefits for a full 12 months. We cannot decrease their benefits. We cannot increase their family share within that 12-month period. Now, at review, when we're redetermining, we could assess a penalty at that point, but not during that 12 months.
Okay, and just to confirm, Child Support Services is a different animal than SNAP. So SNAP.
Correct.
So the federal government's not saying we cannot require cooperation with Child Support Services.
I only know for childcare. Yeah, I do not believe that that's a requirement. That is not a requirement for TANF.
All right, thank you. Thank you, Mr. Chair.
Representative Meyer.
Thank you. Okay, so I am here on slide 22 talking about eligible families back to the 250% and the 85%. For those in the room who may be a little bit confused about the FPL and the median state income, I know that this is getting kind of complicated. You and I think, kind of share, like, we know what's going on, but can you explain a little bit, maybe what FPL means, what the amount is, if you know now. Otherwise, you can look it up. It's pretty easy. And compared to the median state income and how that affects family eligibility for the program.
So I do have a slide coming up that gives an example, actually two examples for two different states, two different counties for what child care assistance would look like for a similar household. And I don't know if that would that be helpful?
Yes, I didn't
Okay.
realize you had a slide like
Yes,
that.
it's somewhere in here.
Okay, thank you.
Okay.
Okay. And quick little tangent, just feel free to, if you're asking questions, just continue asking follow-up questions. I know just in the past, during my 6 years here, that's always been a question. Can you ask a follow-up? Of course, ask a follow-up. Most of the information we're asking questions on has multiple layers. And sometimes it does take several questions to get to the bottom of it. So, as long as it's on topic, feel free, just ask until you've got the understanding you need. So thanks. Thanks.
Okay, I believe we're on general eligibility. Are we still there? All right, so I think we've talked a little bit about child support services, and I will say, so with our current regulations, this is at the state level, for non-cooperation with child support services for either TANF or child care, the first penalty is for 3 months, so we close both cases. So if you have a child care case that is open, but you don't have TANF open right now, we're going to close your child care case, but if within that 3-month period you apply for TANF, we are not going to open your TANF case because you have to, the penalty applies to both programs. The second non-co-op is for 6 months, the third is for 12 months, and then the fourth is for 10 years. So you have to serve that amount of time and cooperate with child support services in order to regain eligibility for the program.
So you're on slide 23, moving on to 24.
Yes, we're on countable income again. Are we all lost here? All right. So this slide just shows, we've talked about the 250% of FPL and the 85% of state median income. One difference about child care assistance is that the resource limit is higher for this program than with others. It is $10,000 for the countable resources that a family can have.
Representative Meyer.
Are the accountable resources similar to those for TANF and SNAP?
Yes,
Okay,
they are.
thank you.
Okay, verifying, again, you've seen this information before. We verify for this program the same way that we verify for other programs. One thing to remember that is different with childcare is that the benefit is for the child. It is not for the adults in the household. So when we verify U.S. citizenship or non-citizenship status, it is for the child for whom the benefits are being requested. It is not for the parents or the guardians.
Representative Lewis.
On that point, I mean, money's fungible, and how is it that you ensure that the money's going to help the child rather than the family?
So with childcare, we have the two parts of it. So on this side, this is our subsidy part where the parent or the guardian is getting those childcare benefits on the EBT card. The child must be enrolled in a DCF enrolled childcare facility. So you have childcare facilities that are licensed by KDHE. A second step of that is that those providers enroll with DCF. They have to enroll with DCF to be able to accept DCF subsidy.
Thank you.
Representative Carr.
Thank you, Mr. Chair. Again, did I miss the definition for non-exempt resources? Was that?
No, I did not provide that definition, but I can.
Okay, that would be fantastic. Thank you, Mr. Chair.
Representative Humphries.
Thank you, Mr. Chair. I just want to, I mean, this isn't exactly a specific question, but it's kind of like this is surprising to me that child care assistance we're offering, and we're preferring a parent to send their child to a non-relative rather than a relative in like the grandmother's home. I mean, so it's kind of, I didn't realize this was part of this.
So child care subsidy can be used for a non-relative. There's some rules around that. It cannot be a relative. If I'm getting child care subsidy for my children, I cannot live in the same house with, my parents.
So, okay.
We do have relative care, yes.
Okay, thank you. That cleared it up.
Yes.
Because I thought it was a relative who was having care in their own home. You're saying a relative who lives in the same home as the child.
It cannot be. We cannot live in the same home.
Okay, thank you.
Right.
That's good, because I was
Yes.
kind of shocked for just a second, so thank you.
Yes. And I will also say that relative does not have to go through all of the health and safety requirements, all those other things that we would require for a licensed facility. Yep. Okay. Moving on to the interfaces, again, these are the same, so the next two slides, you've seen these before. These are the things that the electronic means that we have to be able to verify information so that we can determine eligibility. And then the slide following that, once again, the EBT card is the card that houses benefits for SNAP, TANF, and for child care. Okay, on the next slide, the typical child care assistance households. You can see some demographics based on what we have housed in our eligibility determination system to see what that typical family would look like. And as you can see, 83% of those who are receiving child care assistance are working.
Back up one slide to I think slide 28. So the EBT card, I think there was a question earlier about, so how to track the money. If they're have a child at the DCF enrolled provider, how about the out-of-home relative? How is that tracked?
So that, it's the same thing. It's tracked through that system. So if my mother is caring for my children, she actually goes into that EBT system and she creates an account for herself so that I can swipe my card or I can go online and make a manual payment like you pay your bills online. I could do that same thing with her. There are some safeguards in the system also. So I believe it's 30 days. If I am not paying the provider that is on record, the provider that was used to create my child care plans, the system kicks that out. And I get a notice that says, hey, what are you doing? Because you said you were going to pay Mary and you've been paying John. And so that's a kind of a red flag to us to go and investigate why the parent is paying someone other than the provider we thought they were paying.
Representative Howell?
Suddenly feeling like I'm back in school. Okay, and I just realized I'm raising my hand, I'm looking at the wrong person. Thank you, Chair. So I am a little curious why we don't directly pay the child care giver from DCF.
Some states do that. And actually, DCF used to do that. That was before my time. I do know that we did that. I believe one of the reasons was to make this process mirror the process that parents who are not receiving subsidy follow. So I may be getting subsidy, but I am responsible, so I'm teaching a little bit of responsibility. I am responsible for paying my child care provider just like Mary Jane is, who does not receive child care subsidy.
So just a follow-up on that same thing, does this actually work well? This process? I mean, are we penalizing our enrolled providers by them not getting paid properly? Or, I mean, I could see potential pitfalls here.
The issue comes in when we talk about, so there is a gap, and you'll see that when we look at the examples. There's a gap between what the child care subsidy amount and the true cost of care. So the issue is that gap. And if, as a parent, I can't afford, if I still have $100 a week that's out of pocket, that can become an issue with the provider. It tends to impact family child care providers more than it would for center providers, primarily because those family child care providers, my provider knows I need to go to work. And so even though she may know that it costs $300 a month, that is the true cost of, or $300 a week is the true cost of care, she knows I'm only getting $200 a week for child care subsidy, she's likely to only charge me $200 a week so that my kids have someplace to go so that I can go to work. Well, that doesn't help her in her business practice. So that is an issue, and we do have some plans to narrow that gap, if not eliminate it.
Representative Meyer?
When might you share those plans?
I knew you were going to ask me that. So as you know, and again, we'll talk about this in a bit, we have received an unprecedented amount of money for child care related to the global pandemic. We received more than $467 million additional dollars to support child care. We also what was just passed in the most recent omnibus bill is we will be receiving an additional $16 million per year for regular child care funds from the feds. So with that, knowing that we have that cushion, one of the things that we are looking to do is to truly base our rates, our subsidy rates, on the true cost of care and not just the market rate survey that we're required to do. So instead of basing our rates on what child care providers are charging, we would like to move closer to basing our rates on what it's actually costing them to keep their business up and running in a manner that allows them to provide quality care. So,
Thank you. I'm excited.
Representative Humphries.
Thank you, Mr. Chair. Well, it kind of begs the question, and you said unprecedented amount. And so do you have like a savings? I mean, we're, 467 million plus now 16 million more per year from the feds. Where is all that gone? And do you have a stockpile kind of?
so that's coming up.
Okay.
For where that has gone. Yes, and there are liquidation and obligation dates that are associated with each of the different funding streams we have. So for CARES Act, for KRSA, for ARP, and we're nearing the end of that road of liquidating those funds. But yes, there is a slide that addresses that.
And says what your balance is right now?
Yes.
Right. Okay, we'll look forward to that. Thank you.
Okay. All right, child care assistance compliance. As you can see, and this will take up the next 3 slides, we interact with Office of Child Care a lot. So here you can see those monthly status calls, and I will say with the pandemic funds that we received, those status calls took on a whole new life of their own, and we were required to let them know exactly what we did with each different pot of money that we had, and it was verified that what we were using those funds for really did meet one of the statutory purposes of those funds. So we spent a lot of time making sure that we were spending those funds in accordance with federal guidelines. And then I just listed out again on these next few slides the federal reports that we are required to submit. Some of them, as you will see, are more program reports, and my team would be responsible for those. And then there are those fiscal reports, and again, I don't do fiscal, so someone else does those.
Representative Johnson.
Thank you, Mr. Chair. I know you guys are swamped with paperwork. How much of your budget is spent just trying to keep up with federal reporting requirements?
Well, remember, 5% admin cap for CCDF. We kind of have this down to a science. we really do. So I don't know a specific amount. Nope. Don't have a specific amount for that. But our regular federal reporting is built into position descriptions. So it's not something outside of the norm. I hire staff knowing that this is going to be a requirement of them. For the pandemic funds, we had at one time 2 full-time positions that were solely focused on pandemic-funded activities. And so those individuals are responsible for those reports. And now that we're nearing the end of those funds, those 2 positions are no longer filled. And we're kind of figuring it out for how we're going to continue to manage that over the next year and a half or so. But we've been able to merge those responsibilities into the functions of our existing staff.
Would you be willing to just give me an estimate? Just throw it out there?
I don't know. Seriously, I can go back and look at position descriptions to see what percentage.
I don't need that.
Okay.
I don't need you to do that. Sometimes we have to deal with, and I know the reporting requirements are just massive. And so that money doesn't go to the daycares. It goes to administrative costs. So, but thank you. Thank you, Chair.
Well, and I would remind you that the federal guideline is 70% of those discretionary funds on direct services. So we have to figure out how to do that other stuff with some of that other money. And that doesn't include the 9% for quality and the 3% for infant toddler. So there's not a lot left over for the other things. Okay. I'm going to move more into, or a little bit more into compliance. There are 3 primary methods that the Office of Child Care uses to make sure that we are in compliance. And on the next slide, you will see we're going to start with the on-site monitoring visit. It is conducted every 3 years. In our most recent monitoring visit, they're pretty extensive. So we know ahead of time the things that Office of Child Care is going to be looking for. They're looking for to make sure that we have policies and procedures in place. This last time around, they went as far as, so there's a federal guideline. And then they're looking at our state statutes to make sure that what's in state statute aligns with what's in the federal statute. And then they wanted a policy memo that went out to the field that says, here's what you're supposed to be doing. So they asked our child care subsidy program manager, what do you think the policy is? And she was able to say that, and then she could show how she communicated that to the field. And then they reached down to a field office worker and said, well, what do you think the policy is? To make sure that what started way up here with the federal government actually made it down to the eligibility worker who is doing that boots on the ground work. So that's kind of what a monitoring visit looks like. And then they're looking at our policies and our manuals to make sure that everything is in alignment. On that slide, I also listed some of the findings, the primary findings from our most recent monitoring visit, which took place in 2021. And you will see 12-month eligibility is one of those that we are trying to address now.
Representative Wagner.
Thank you, Mr. Chairman. It does mention in your slide posting aggregate data on serious injuries, deaths, and substantiated abuse. Do we have serious injuries and deaths in Kansas in child care?
We have not recently, but we must, that is a requirement, those must be posted. DCF has an agreement with KDHE to make sure that we are adhering to the licensing requirements for our CCDF funds. And so, yes, what's on their website must align with the federal requirements for reporting those. And it has to be easily accessible to anyone who's trying to find childcare. I should be able to go out on that list and get that information easily. Okay. All right, on the next slide, I talk about our CCDF state plan that is also submitted every 3 years. And these are the requirements. Our state plan is massive. And so these are the bulleted list of the things that we have to address in our state plan. This is just high level. There are subsections to each of these. And so we are told specifically what we have to do and what we have to provide as evidence that we are meeting these requirements.
Representative Meyer.
I had a couple questions on this slide, just maybe so that you can clarify a little bit about what you mean. So for ensuring equal access to child care for low-income children, could you kind of clarify what that aspect of the programming looks like? Or the plan, I'm sorry.
It truly is making sure that everyone has equal access. So I'm not making it, I'm not erecting barriers for low-income families. I'm not telling someone who, a population of individuals who may not be likely to have reliable transportation, that they have to physically drive to the DCF office that is 45 miles away in order to apply for benefits. Have to make sure that there's a process for those individuals to be able to apply for and obtain benefits in a manner that is equitable for them. It also involves the programming. So for our DCF enrolled providers, there are classes that they have to take. Are they being equitable in their treatment of children, in their hiring of staff, in the programming that they have? Those are the things that the state plan would look at.
Okay, and that's perfect because that kind of leads into my next question about recruiting and retaining a qualified and effective child care workforce. So can you go over a little bit more about what the state plan does as far as that goes?
We right now I would call it a recruiting campaign. And I don't know if you've seen any of our ads, but we've hired a marketing firm who's helping us to do just that, to help individuals understand how important this work is. It is difficult. As we've noted, when we're talking about that difference between the true cost of care and what providers are charging, you're not going to be rich as a child care provider. And so it's a little difficult to tell someone, hey, come be a child care provider and you may net $3 an hour for your 14-hour day. So we are working not only to attract child care providers, but as I mentioned earlier, putting those things in place that will make it a more attractive career, and helping people to understand that this is not babysitting, this is not daycare, this is childcare, and it plays a critical role in child development and in supporting families. So another thing that we're working for, I talked about the QRIS system, the quality rating system, and in Kansas we call that links to quality. So as providers take classes, and so they earn a badge and then they get a link. So now I am great. I know what it looks like if the care that I'm offering is not equitable. And so now I have moved to, here's what my program should look like, and I've taken the steps to make sure that my program looks like that. Once you earn that link, what we would like to do is to be able to compensate you for that. So now, instead of your subsidy rate being, your maximum rate being $3 an hour, maybe now it's $3.50 an hour across your entire program for every child you serve who's a subsidy child, to make, not just make it more attractive for that field, but again, to give our providers the tools that they need to be able to truly provide that high quality care. Okay, on the next slide, state plan continued. You can see we do have a current corrective action plan for our state plan. These are the primary findings. That final bullet point, the narrow cost analysis, I addressed that previously. We had been solely using the market rate survey to determine our rates. We have had a narrow cost analysis performed, and those, we're trying to move our rates to that higher standard. And 12-month eligibility, again, was a finding. Okay. You've seen these before. I've talked about how we evaluate performance measures for our programs. These are just 3 that directly relate to our child care, not just our child care program in terms of CCDF, but also our early Head Start and Head Start programs, which are housed under DCF. Okay, on the next slide, the state match calculation and CCDF award allocations. So I know we've had some questions about the state MOE. On here, you will see that exact dollar amount. That is our state maintenance of effort. And then as I talked about the allocation definitions earlier in the presentation, this is what that actually looks like with the numbers attached to it. Okay. CCDF spending in Kansas, these are the 5 primary categories that we have for spending. And so on the next slide, the CCDF expenditures, you can see again those dollar amounts that are attached to how we spend funds in each of those categories with a little more detail. And you may also notice that some of our pandemic spending is included in this table.
So on the pandemic spending, it's a lot of money. Could you
Yes.
have a quick overview of what
I
some of
do,
that went
yep,
towards?
yes, we're going to get into that, absolutely.
It's coming?
Yes, yes. And then the next slide with the pie chart, these are our expenditures without the pandemic funds included in that, to give you a better understanding of what real life looks like without those additional dollars.
Representative Meyer?
I don't really know how to phrase this. This is a question and a statement. Would you say that it has been a lot easier for families to access childcare, as well as having service providers be appropriately compensated with the additional monies from the pandemic services?
I would say the money from pandemic services has allowed us to really build a foundation, to put some things in place that we were a little hesitant to do before, because for one, we didn't know how we would be able to sustain them. So we were able to do some things, try them out, see what the usage was like, what the true cost was for those things, and now we're like, oh, we can't afford to do that long term. So yes, it has been beneficial.
So you do think even without the pandemic assistance that there is a way for the state to be able to afford to extend those services and maintain those services?
Absolutely.
Without an increase in an allocation from the state?
So we do have an additional $16 million that starts this federal fiscal year over what we were traditionally getting for our regular CCDF funds. That alone helps us to, with that assurance that yes, we can continue to fund some of these initiatives.
Okay, and refresh my memory, that 16 million, that is a yearly amount that will be allocated, correct?
Correct.
Okay, perfect, thank you.
Representative Wagner?
Thank you, Mr. Chairman. The CCTF expenditures, I mean, of course, you had fiscal year 2022, and the totality was 365 million. Then it drops basically to 226 million, then down to 101 million in fiscal year 2024. My question is, obviously, you had all this federal money that was being thrown our way. What is the total? I mean, how much is the total amount spent by everybody on childcare in Kansas? Is there any data on that? I mean, like what's the total market? Private pay, the whole, just for the totality of childcare industry in Kansas?
That I do not know.
Okay.
I might be able, Childcare Aware may have that information, I can check.
Okay, I'm just,
So you mean the total amount that families are paying for childcare?
I mean, is childcare like $1 billion industry in Kansas, or it's a
Oh,
half,
I see what you're saying.
it's like how large is the industry? And just trying to get a sense for how much of it is then funded through governmental support. That's where I'm going.
All right. FTEs related to child care services. So this, I would say with this, the numbers that you see for our eligibility staff, those are not just staff who process child care. As I mentioned, we have a combined application. So as an eligibility worker, I had to learn the child care program, the TANF program, and the SNAP program. And what we've estimated is that roughly 9% of the time is when those eligibility workers are processing solely child care cases. Okay, on the next slide, child care facilities. In Kansas, I talked about how that we have licensed providers and then we have DCF enrolled providers. So again, a provider must be licensed in order to become DCF enrolled, but we do have licensed providers who choose not to be DCF enrolled. And this just gives you the numbers by license type that would be in the KDHE database.
Quick, on the previous slide, 42, your full-time employees, how many are filled of those positions?
I have no idea. We can find out.
Okay, because this is your estimate or recommended number, the 635 or 633?
This is what we have right now, but this does not compare to the open positions that we have. So this is what's filled. I don't know how many open positions are out there, but we can find that. Yeah.
Yes, sir.
Oh, thank you, Chris.
The numbers that are showing here, those are the budgeted positions. So these are the positions within the agency that are dedicated to eligibility services and client service delivery for all those programs. I'd have to get you what the vacancy rate on those is right now.
Okay, so these numbers are the max that, okay, so they're not actually the current filled. Okay, great, thanks.
Mr. Chair, could we get that number?
Yeah,
Okay.
Do you want it total? Do you want it by region, by?
I guess in about every single committee, we hear about workforce shortage and everybody's struggling. So I know the full-time equivalent for my 6 years here, it's a budgeted number, but
Okay.
it rarely is the actual number. So yeah, it would be good to kind of get that actual. Thanks. Representative Carr or Mayor Meyer?
Okay, back to the slide 43. So looking at the differences between licensed facilities and licensed and DCF enrolled facilities, it looks like there's a pretty significant gap in some of these areas. And I noticed that when you said the difference between the facilities, you mentioned that some chose not to be enrolled. Can you elaborate on why that might be, what the situation is that is leading to that? And the follow-up question would be, how can we work towards making that gap smaller?
So we don't know definitively. We have some assumptions. We don't know. And one of the things that we are funding with our pandemic dollars is a family needs and preferences study. So we're asking, we will be asking of families, and we've issued a contract for a university to conduct this study. Why do families make the choices they make? Why do they choose unlicensed care and instead of licensed care, things like that? But then we're also looking at providers. Why are you choosing? So tapping into some existing provider groups, we would like to know from the providers, why are you choosing not to become DCF enrolled? There's one additional requirement. It's 1 3-hour class, I believe it is, that they have to take to be able to be DCF enrolled. I can't imagine that it's just that, but we want to find out from the providers exactly what the barriers are so that we can address those.
To follow up a little bit, and just a question, I understand how providers take payment. I wonder if some of the in-home daycare facilities maybe don't have access to a computer to receive their payments, or an EBT card slider or something like that. Is that a barrier that's been looked into to maybe work towards?
It has, and that kind of falls along the same lines with equal access. One of the things that we were able to do with pandemic funds, this was an allowable use, was to allow providers to purchase those things. So if it's a laptop, a desktop, an iPad, whatever will help you with that business, those are some things that providers were able to purchase.
Representative Carr?
Thank you, Mr. Chair. So with relationship to the licensed and non-licensed, is there a difference in what the licensed versus the non-licensed is charging as a rate? You spoke earlier about the actual cost to provide care versus what they were actually accepting. Have you found that may be part of what you're looking at as a discrepancy here?
I would assume, and I don't like assumptions, that could be part of the reason, but we don't know. That's one of the things that we're hoping to determine, because obviously for our licensed providers, we want them to become DCF enrolled. If we don't have enough, so we can continue to enroll families in subsidy, but if we don't have enough DCF enrolled providers, then they don't have anywhere to use that subsidy. That is a great question, and that's one of the things we're hoping to find out in our research.
So do we have data that represents that, or is this something that we need to look into moving forward?
We are looking into it with the family needs and preferences study that we're looking at, and then also through our partnership with one of our community partners, our resource and referral agency. We're hoping to, again, look at or meet providers where they are in existing work groups that they have, and basically survey them during that and have that conversation with them at that point to see what those barriers are, what is the true reason. Because the last thing we want to do is to pour money into a program to meet need B when need A was really what needs to be addressed, and B is not even a need. So we are looking at that.
Thank you.
Representative Meyer.
I just had a follow-up as well. Going back to this again and thinking about licensed facilities versus licensed and DCF enrolled facilities, is there any way that you could give us a breakdown of what that looks like as far as how many families have been allocated a subsidy per county or region versus how many providers are available within an appropriate distance, so that we can get an idea of how pressing that issue is?
Do you want households or children or both for subsidy?
That's a really good question. Let's just do both, because
Okay.
I think that would kind of suss out some other questions that might come up from that. But really, I'm trying to figure out, it sounds like there may be a pretty significant gap between the availability of providers and the individuals who have the DCF subsidy for childcare, which may present a barrier for them receiving services, especially considering waiting lists and things like that. So I just kind of want to get a better idea of what that looks like, either regionally or by county.
Okay.
Okay, thank you.
Representative Howell.
Yes, thank you. I know I'm asking a lot of questions. I apologize. Thank you, Chair. When it comes to our rules for being a licensed facility and a licensed and enrolled DCF facility, are we operating on federal standards, federal and state standards? I mean, I just know nothing about that part. So if you could kind of just give me a brief overview, that would be wonderful.
We are operating under both federal and state standards. What we try to do in our work with KDHE, again, they are responsible for licensing. So we fund those activities with CCDF dollars. And what we try to do is to keep the standards similar. So we don't want to have licensing standards for DCF enrolled providers and licensing standards for the general population of providers. Because if the licensing standards for DCF enrolled providers, which must match federal statute, if those requirements are significantly higher, then there's no incentive for licensed providers to become DCF enrolled. So we try to match those up. But yes, it is both federal and state requirements.
And KDHE is the department that ultimately controls that?
They do, but we have an agreement with them. We have an interagency agreement with KDHE. So for when Office of Child Care, and they host monthly licensing meetings. So just for those individuals involved with child care licensing, and involved in those meetings are people from my team with CCDF, and also individuals from KDHE who are involved in the licensing process to make sure that we're all on the same page.
Thank you.
Representative Hoagland.
Thank you, Mr. Chair. My question is that 3-hour course that you have to get the DCF, is that given during times when they're watching children, or you give them?
We give them options, yes. So we don't provide those directly through DCF. That's another contract that we have, and that organization very much aware of what demands on the time of childcare providers. So they will offer online, in the evenings, on the weekends, whatever will work for providers. They will make sure that there's a method that meets their needs. Yeah.
Representative Humphreys, you still have
Thank you, Mr. Chair. So these numbers, can you give us a little bit of history on, like, this is what we have now, this is what we have now, and, how does that compare to like what we had before the pandemic?
For the childcare facilities? Yes.
But you don't know that, you don't have
No,
that?
no.
Okay, because I think if I recall, there was some, licensing we sort of put on hold a little bit during the pandemic, and then we had a decline in childcare facilities after that. And we really should try to get to the bottom of why did that happen.
Yes, and you are correct. So there was a federal waiver on licensing site visits, so they did put a pause on those. But then, yes, there are a number of facilities that closed their doors during the pandemic, and that was the primary purpose of the recovery funds, was to help those programs stay in business.
And I know this isn't exactly the, I guess it has a little bit to do with this committee and this presentation, but, I know there's been talk of regulation in childcare facilities and just the burden of that regulation and the number of hours, you can keep someone without being licensed. I've been through all that because I've been on the Children and Seniors Committee. And I would like, maybe, Mr. Chair, if we could look into that as it has to do with our licensed facilities and DCF enrolled, are the regulations is a burden for people to overcome? And so that's part of the reason that we could be in a crisis.
My caution would be that with health and safety standards that are set forth in the CCDF final rule, if we establish a layer that is below those standards, those facilities would not be able to be DCF enrolled. They would not be able to receive child care subsidy.
And do
families.
those have numbers? As far as hours, I should say. Hours, I understand health and safety centers, of course, but, as far as how many, at what point do you go from being the neighbor down the street to needing to be licensed?
So you want the licensing standards, like based?
Yeah, that would be great.
category?
Yeah,
Okay.
that'd be great. Thank you. Thank you, Mr. Chair.
Representative Johnson.
Thank you, Mr. Chair. Just to lead in, happy wife, happy life. Okay, your classes that you have and that are required, there are some problems in how those are administrated because variety in daycare. Part-time workers during the day, then requirement to attend at night, 12-hour days. And I've audited some of the online classes, and the amount of time that's estimated for those does not correlate with what it actually is taking our workers. And I've audited them with my wife taking those classes, and I clearly believe in the training, but I think we need to look at how those are being applied to a variety of different daycare operations, the mom and pops, the daycare centers, and the cost to our daycares. So I guess that's more of a comment to you. Thank you.
And to address that, I would say, and if you go back to that slide with the COGS, my responsibility as a CCDF administrator for the state is to make sure that all voices are heard. So it's not just, here's the state, or here the feds saying, here's what everyone down here has to do. Those are things that we need to know. And so, wanting to make sure that we have that system set up so that providers can express those concerns, and so then we can address those concerns. It is certainly not the intent that we burden providers. We need providers. So.
Representative Carr.
Thank you, Mr. Chair. I want to go back to the previous question that was posed by Representative Meyer with relationship to the geographical location. You mentioned that you could get that breakdown with respect to county. I'm more interested in the possibility of a breakdown with respect to some of the less fortunate zip codes. Do we have a breakdown that would give us that information?
Yes, we can do that.
Thank you, Mr. Chair.
Oh, yeah, right.
Okay. I can like fly through these. We've talked about the market rate survey and the narrow cost analysis and what those things look like. That following slide are the examples that I mentioned. So you could go through for those different counties to see what the actual out-of-pocket cost would be for a household. And then in the next slides, you will see details around the pandemic funds that we received. So some of the allowable uses, some of the primary allowable uses for each of those acts, some of the things that we have done so far with those funds. I think that was it, unless someone has questions. I will say, as you can see, $467 million, that's a lot of money. I have an amazing team of individuals who are not only skilled, but they are dedicated to the work that they do in serving Kansas, and they have been awesome in getting money out the door to those who need it the most. So kudos to my team.
Representative Meyer?
Okay, so now I really appreciate your workers because this was so vital during the pandemic, I think, for families and providers. But one of my questions was, and maybe I haven't gone through the slides closely enough yet because we're in a rush, but real quick. So for providers that had to shut their doors, did they have to apply for PPP loans, or were they able to receive some assistance through this fund directly?
We could provide funds directly. Yes.
Awesome. Okay. And were there any issues that you ran into with that? I don't really want to say fraud because it sounds like there wasn't a lot of that happened necessarily at least your level from what I understand. But I mean, just general issues for providers being able to access the funds for being able to use them to restart their businesses, things of that nature.
We also funded child care health consultants. This is a child care health consultant network. And those individuals so you were in danger of shutting down as a provider and you have no idea what to do. You reached out to Child Care Aware and said, I'm closing my doors. We could have those health consultants come in and say, well, hold it. Here are some options that we have. And so we can not just point you in the direction of here's the link to apply for these funds, but walk you through that process. You don't have computer access at home? That's okay. I will come to where you are with my iPad and I will help you apply for those funds. So we provided that kind of service to help keep them going.
Representative Humphreys?
Thank you, Mr. Chairman. So just a couple follow-ups, I'm sorry, as I've gone through and had just a few more questions. I think you mentioned a corrective action plan. I think this goes back to slide 34, which just says
State plan?
the state plan. Did you say that you're doing a new plan?
No, so our current plan is effective, is for 2022 through 2024, and we have a corrective action plan. So there are some items, very specific items that we have to correct in order to become in compliance, to comply with the federal standards.
do we ask for a copy of that, or could we get a copy of
Yes,
that?
we did ask for a
Did,
copy
we
of
already
that.
did. Okay, I'm sorry. And then,
I'm sorry, the corrective action plan or
The
the letter
corrective
that
action
explains what needs to be corrected?
I guess everything. Okay. And then just to make sure, because I think this has to do with that, because you mentioned the federal funds with the cooperation with the child support, that I think maybe that's a bill or something that's coming up. You said something about how they're issued for 12 months. And did you say you go ahead and issue the child care help even if they've not cooperated, even though right now statutes say they must cooperate?
We do that with all programs. So we determine eligibility and we make that referral to child support services. So if I can go into the child support system and see that that someone is not cooperating with child support, we would not issue benefits. But if there's no non-compliance in the child support system, then we would issue benefits, but still make the referral so that we can make sure that this person really is complying. And then when we find out that they're not, that's when the penalties come into play.
But they still you've already issued 12 months worth of help.
Not a full 12 months. So we call it a child care plan that is for 12 months. Benefits are issued 1 month at a time. So the first of every month is when benefits are issued for that month.
Okay. Okay, so just to make sure I understand, you go ahead and issue the benefits even though you don't know if they're cooperating with child support. You know that you don't know if they're cooperating or not with child support, but you go ahead and issue.
We don't have any indication that they are not cooperating.
You go ahead and issue, and then once you find out let's say they're not, once you find out they're not, the benefits would stop right then.
Correct.
Okay, thank you. Thank you, Mr. Chair.
Quick last question here. Maybe the 47, the slide 47, you have the award amount, and then you have the liquidation amount with the liquidation date. Can you briefly describe what does all that mean?
Each spending bill has its own obligation and liquidation dates. So obligating, we have a signed agreement that says here's what we're going to do with those funds. Liquidation means that money has been spent. So if we entered into agreements for funds to go directly to providers, that money has all gone out to the providers. It's been accounted for.
So the difference is what you still have to find a place to spend it on?
Not necessarily. That difference on this spreadsheet, and Chris, correct me if I'm wrong, we could have obligated that. So we've said, so you needed $500,000 for a project. That's what we have in our obligation, but you've only spent $300,000 so far. So I'm going to consider that other $200,000 not liquidated because you haven't spent it yet.
Sounds good. We got another minute. Representative Carr.
Sorry, thank you, Mr. Chair. So based on that conversation, am I to look here and assume mathematically that we're talking, there's still almost 200 million?
No.
That is,
Nope.
no?
Nope. That is not the full amount that has not been spent. So there's some dollars that we know are going to be spent. We may not have verification that they have spent, or the agreement is still in place. So for example, for the ARP discretionary funds, we still have until September of 2024 to liquidate those dollars.
Okay, thank you.
Representative Meyer.
I just wanted to clarify, because I'm a little confused, based on the former representative's comments regarding child care assistance and child support enforcement and noncompliance. I thought that you had previously mentioned that federal requirements dictated that the child would be eligible for the child care subsidy regardless of whether or not the adult in the home is compliant. Is that?
That is correct.
Okay, that is correct. So in that case, then the child would still be eligible for those subsidies and they would be able to access child care even while the child support compliance issue is being sorted.
Correct.
Okay, thank you.
And as a reminder, child care subsidy is for the child.
Thank you for stating that.
Representative Humphries.
Just to clarify, but the state requires cooperation.
Correct.
So the federal government doesn't. But again, slide 5 said the state has flexibility to do some different things. So
This is not one of those areas of flexibility.
how has that been in statute for years?
That I cannot answer. And this is not the first time the Office of Child Care, my understanding is that this is not the first time the Office of Child Care has called us out on this. So we're trying to address it.
Okay, so right now you're following the federal guidelines and not the state guidelines that are in our statutes.
No, we are following the state guidelines. So once non-cooperation is established, we close the case. So a family who has been determined to be in non-cooperation can no longer receive benefits based on that penalty schedule.
Okay, I understand that. But in that meantime, they do get benefits even if we haven't established that they are cooperating.
Right.
Okay, thank you.
All right, thank you, Doctor. Committee, sorry for running a little late. We have I guess also in the packet, Jesse from the Revisor's Office has the statutes that relate to some of the discussion today. We'll see you Thursday for all the work requirements for all these wonderful programs. All right, thank you. We are adjourned.